Good morning, Daniel. I'm fine. And you?
Great. Thank you for joining us on the Super Morning Show. Now, lots of institutions have been in their own different ways as part of their own scope of operations, helping to fight COVID-19 in many different ways. Now, your institution deal with kids and their advancement. And I'd like you to, just before we talk about the real issue, tell me, how have you been helping in this period of COVID-19? When I say you now, I mean your organization.
Yeah, of course. Thank you. So, KEEP has been over the years primarily promoting a culture of reading and
Mm.
encouraging children to read. And we've been establishing libraries all across the country, many libraries. And currently, we have 18 libraries in 8 counties.
Okay.
So, one of the things we do every week has been to have reading sessions with members of our reading clubs in the different public schools that we work in. And we've had over 100 reading sessions in the last 2 years. One of the things that we had to stop doing when schools got closed because of the coronavirus has been our school reading sessions.
Yeah.
So one thing we quickly shifted to was to doing the sessions instead on TV. So having storytelling sessions on TV.
Mm.
That has been very widely received. We've had it on Tama TV and most recently on Power TV. We also started distributing up to 500 phones with members of our reading clubs as well, so that they could take part in the Ministry of Education's learning by radio programs that they've been having for the different subjects and different grade levels. So we distributed phones and radios in 3 counties, Grand, Judea, Bapulu, and Monserrato, along with phones
Mm.
and the Ministry of Education schedule so that the kids who in the public schools who may not have that resources could be able to tune into the different programs and listen. Another thing we did when the virus struck was to change I mentioned the TV programs. We also realized that a lot of people don't have access to TV.
Mm.
So we started the storytelling sessions on radio as well. So we have 10 to 15 minute radio set and storytelling sessions on 4 radio stations currently.
Okay.
So, in a nutshell, those are some of the things that we've been doing. We've also made our room available, a couple of our rooms available, particularly one on at the YWCA. So people can stop there and pick up books if they want to be able to keep their kids engaged in a constructive way.
And so far, what have been the response of some of the kids as to the fact, because it's difficult to even get children to pay attention for a long
Mm-hmm.
period, especially when you have to make them read.
Yeah. So two things. There's different feedback with the learning by radio programs.
Okay.
Some of them have challenges either with the local radio stations that's supposed to be relaying the ministry's programs not being consistent with it.
Okay.
Some of them have challenges in catching some of the radio stations. But then there are some of them who are also very keen to participate. So they have the schedule. They actually make time they sit down and they know when they're supposed to tune in and study. And we actually did monitoring last week. Let me just share this little joke. So we gave them the phones and we gave them our numbers, and we have all of them have numbers that were provided by MTN free of charge. And we will call some of the numbers are consistently off. So we're wondering, whether they're having charging issues and all of that. So one of the
Mm.
communities who went to follow up, okay, we gave you phones for the kids to be able to, follow with the programs. What happening with calling your phone is off. And in the chat said, charging bases are problem. So the exact time the program coming on, 1 minute to the program coming on, we
Then
put
you put
our phone on, we listen to our lesson. Soon the lesson finish,
you got it.
we started off. We
Wow.
also provided the numbers to the children, and I even made a social media post laughing that one mistake I made was to put my personal number on the phone. So sometimes after they hear some of the storytelling sessions, they will call. Oh, auntie, last story was not easy. I
I
enjoyed the
know.
way the buffalo getting their food to eat. And so we've gotten a lot of good feedback from the kids. Some of them really follow. Some of the parents are busy; they don't have time, so they don't support as much as they could. But generally, we've gotten a lot of good feedback from those who've received either the phones or the radios.
Very important. Now, quickly, now I understand that a couple of new materials have been produced by your organization
Mhm.
to assist kids and ensure that parents can be able to monitor. Tell us about the book and how parents can get hold of it.
Great. So we recently did a soft launch of a project that we're working on with OSIWA, and OSIWA is the Open Society Initiative for West Africa. And we developed an activity and coloring book for kids 7 and below.
Okay.
And the intent of the book really is to educate young children about the coronavirus. But
Oh,
it's a
okay.
difficult thing most times for older people to explain
Mm.
complex things to little children. So we decided to break it down in very simple terms. So we did a coloring book. Kids love to color.
Yeah.
We developed a coloring and activity book that gives different exercises that parents or caregivers can do with the child in the book that explains the virus. So be it an activity, for example, telling them that the virus is round, like a circle, them tracing the dotted lines, them knowing how to spell circle, them knowing how to spell corona, them learning how to write the words corona, coloring the different images. So the book has different activities that young children can do, but in the process, they get to learn everything about the virus, whether it's what are the signs and symptoms, whether it's about social distancing, whether it's about healthy hygiene practices, etc. The books are being distributed free of charge,
Okay.
and it's being distributed across 5 counties. And it's not just Keep. So Keep
Which counties?
is so we're looking at Grenchide, Monserrato, Bapolu, Bon County, and then Margibi County.
Any specific reason for the selection of the counties?
Yeah, so we selected counties that because I remember in the beginning I said we have presence in 8 counties.
Mm-hmm.
So we're targeting counties that we have offices and we have staff who can support with the distribution. But also We Care is also going to be distributing up to 500 250 copies of the books. And then Phil, and they work in Margibi and Grand Bassa counties. So they'll be taking a couple of the books there to their locations that they're working as well.
Mm. Okay, I get that clearly. Now, for parents who, because this is important, simplifying the
Hmm.
message of coronavirus and parents having to, teach the children while they color and make it fun.
Hmm.
As a parent, even though my daughter is still 6 months, but how can how can a parent get access to this kind of free of charge material?
Great. So the books, I keep stressing the books are free. I'm stressing it because we've made it available online and we're encouraging people to go on our website and download the book. It's 100% free, meaning don't print it in color and sell it because the intent is to educate and it's to make sure we reach a large number of people. So it's available on our website and that's www.keeplib.org. And then you go to where you have media. Under media, you will see downloads. So right there, you see a copy of the book that's available free of charge that people can download. So the book is on our website
But
that you
Brenda, you
can.
know that for example, say some of these counties that you're talking about,
Hmm.
some parents may not have access to internet and
Hmm.
all of that. So so now it's only for those who have access to internet. Not everybody has access, have the megabytes sufficient enough to download to download the book.
Well, the good thing is
Mm.
our website is free if you're using Lone Star MTN.
Oh,
So Lone
really?
Star MTN has made our website zero rated. So as long as you're using Lone Star phone, if you go on our website, yeah, let me put it that way. If you're using Lone Star, you go on our website, you can download the book for free. So you just
Okay.
need to have a smartphone that can go online. And if you go on our website under our media
Mm.
page, you will see downloads. You can download the book for free if you're using MTN.
Okay.
We realize that we're not going to have the resources to print millions of copies to distribute to all the school children. So we just made it available online so people can be able to, download it for free and print and be able to make sure they educate their kids with it.
Well, in the long run, I hope you can get some, financing from partners. Maybe you could print a few copies to
Yes, that would be a
distribute.
deal. That would really be a deal because the physical copies that we have, there are 1,500 pieces. So it's not really a lot, and we're hoping that if we get funding, we can be able to print a whole lot more so that more kids can have the actual book to be able to use. And we're hoping also that down the line, the Ministry of Education can incorporate it into the national curriculum. So for the ECD group, so that when it's a tool that parents and teachers or parents can use also, just educate on just about just any virus, because it talks about safety, it talks about healthy hygiene practices, whether it's washing hands, whether it's blowing your nose into a tissue, different activities there that they can teach their children about general health.
One quick final question. Yeah, what is the age range of kids who can be taught what's into this simplified version of basic hygiene and virus prevention material?
Oh, great. So we're targeting 7 and below. So seven
Okay.
and below can, yeah, take advantage of it. And some kids are smart. So from as early as 3, 4 years, with some of the children can hold crayons and they can color. So yeah.
You're right. You're right. You're right. Well, thank you very much for joining us this morning, and I hope we can, another time when we have more time, we could talk about other, great issues regarding education. But I know that any words on the fact that returning to school, we're hearing a bits and pieces of it.
Yeah, I'm hearing as well that schools might be reopening very soon. Just implore a lot of schools not to sit and wait for government to show them practices, healthy hygiene, healthy practices for the school. They got to make sure they get the schools ready, whether it's sanitizing the place, making sure that they have enough hand washing stations, making sure they have clean, latrine facilities, and having clear plans on educating the kids on being socially distanced and, and, uh, taking care in the classroom, so that we don't have any increase in cases or something. So schools should be ready. The kids have lost a lot of time with the shutdown, so I hope they have plans in place to really try to end up the school year properly.
Thanks, Brenda Moore, for joining us this morning. It's been a pleasure having you.
Thank you, Daniel. Thank you.
Thank you very much. She is the head of Kids Education Advancement Program, Engagement Project, sorry, KEEP for short, joining us live on the Super Morning Show.